Several years ago, we took a family vacation to Yellowstone. We couldn't wait to see all of the amazing landscape there and to see the buffalo. Or was it the bison? Which one is it? Well, before we went, we had to check it out. So we looked it up to find out that buffalo and bison are two different words for the exact same creature. So there only is one animal and there are two different words for it. So calculus or tartar, which one is it? I'm Dr. Scheurer at Tranquil Dental, and that's a common question that we have. People get confused between calculus and tartar. It's actually the exact same thing. There isn't anything that's different about it, just two different words we use. Sometimes it has to do with the location of the country, tends to favor one word over the other. Sometimes it has to do with a personal preference. Some people say, I hate calling it calculus because it makes me think about that difficult math class. And other people say, I hate calling it tartar because it reminds me of tartar sauce that I eat with my fish sandwich. So whichever one you call it, it's the exact same thing. And what calculus is, or how it forms, is from plaque that sits around for a really long time and gets hard. So plaque is really soft, and we've talked before about plaque. Calculus or tartar is really hard. The plaque sits for a long time and gets hard, but there's also a different way that it is able to be formed. And that is that the minerals that are in your saliva will grab on to your tooth structure and they form like barnacles there, and that's the calculus or the tartar. So the same way that pipes sometimes will have hard water buildup on the inside of them, it's the exact same thing. And these barnacles are just so hard on there that you can't get them off with brushing and flossing. So that's the main reason why you come to the dental office, is to get those hard deposits off, because there's no way for you to be able to get them off on your own. Calculus, as it starts, usually starts out as a kind of chalky white yellow material, and as it builds and sticks around for a longer time, it starts to get stained, and it can kind of get to like almost green color, but definitely a black color. And we know that that is calculus. It's been sitting around for a really long time. Also, calculus or tartar usually isn't able to be seen visually on x-rays, but they're actually, if it's able to be seen on x-rays, it's something that's been sitting around for a long time and built a larger substance there. So one of the scans that I took, and you know I love my scanner for so many different reasons, but one of the scans that I took recently I thought was a good visualization. So what's so great about the scanner are many things, but one is that you can actually see the teeth, the top teeth, the bottom teeth, how they fit together. But I can actually take that and rotate it around so we're looking like we would through the back of a head. And so as I rotate this around, you can actually see one of the most common places that calculus or tartar builds up, because part of the reason that it builds up is the minerals that are in your saliva. Then it tends to build up where you have salivary ducts. So on the top teeth in the back, on the cheek side, your parotid glands, your salivary glands will drain there. So sometimes we'll get some buildup there. But you tend to get a lot of calculus buildup on the lower front teeth on the tongue side, and that's from the submandibular lingual glands that are producing that saliva right there. And so that's common to see it on the lower front teeth. So if I take away the top teeth from this image, you can see the bottom teeth, and you can see all that yellow right there. That's a lot of buildup of calculus or tartar. One of the big problems with regards to calculus or tartar is that it irritates the tissue, gets very red and tender and raw, kind of ulcerated in that area and inflamed. And so then that is gingivitis, or an irritation of the tissue. As the calculus builds up, it actually causes the tissue to move away. It really doesn't want to be where the calculus is and all the bacteria and the plaque, the buildup there. And so it will actually, your tissue will move down, so you'll get some recession. And when that happens, the gums don't just recede and uncover bone, but instead, if the gums are receding, the bone is resorbing underneath there. And when you lose dental bone, you don't get it back. So this is a large amount of calculus, or a medium, I guess, size of calculus there, but it's definitely the type of situation where we have to get off the majority of that calculus. And then sometimes we'll need to bring a patient back to clean the rest of it off. So I thought this was a really great image, and afforded us the opportunity to be able to see that calculus there. Like I said, I love my scanner for so many different reasons, but this was one. So since we talked about plaque before, I thought we'd talk about calculus, or tartar, and how it's formed. So we definitely want to make sure that we're not letting it build up, because when it builds up, it irritates the tissue and causes the bone loss, which is periodontal disease. So we want to make sure we're going regularly for our dental hygiene visits, so we can make sure that all of that calculus is removed and we don't let it build up. So when you go to the dental office to have your teeth cleaned, make sure that you ask them to get all of that buildup off, whether it's calculus or tartar.